Scott County, providing safe, healthy, and livable communities.
Thank you, Commissioners. We're here today to discuss emergency preparedness, both with our Department of Emergency Management and with Department of Public Health. I'm going to go around and start just introductions as we go around the table. I'm Danny Lenz, Chief Financial Officer for Scott County.
Jake Grusin, County Library Director.
Jennifer Schultz, Enterprise Risk Manager.
Alexa Runquist, Scott County Emergency Preparedness Coordinator.
Ron Holbeck, Scott County Deputy Emergency Management Director.
Lisa Brodsky, Public Health Director.
Scott Hodge, the Director of Emergency Management and Communications for the Sheriff's Office.
Leslie Vermillion, the Deputy County Administrator. So we're going to get started. This is emergency preparedness, first time here at Scott Delivers. So in the 4 or 5 years of the program, it's a good one to see. I'm glad you're here today. And with that, you guys get about 5 minutes to give some background, and I'm going to hold you to that. And then we're going to ask some questions, and then we're going to turn it over to the audience and then to the board for their final questions. So with that, I'll turn it over to Lisa and Scott.
I'll start.
Go for it.
Okay. So just a little bit of an introduction. Just emergency preparedness per se is not really a program area, but really multiple programs under the emergency preparedness umbrella. It really is a vast and complex area, hence the vast and complex packet you have in front of you. For emergency management, they have 32 capabilities, and we have, public health has 16 capabilities. Each of these really can be interpreted as program areas. They are all federally mandated for us. For example, under public health, we have to do medical countermeasures, dispensing, mass care, fatality management, volunteer management, just to name a few. Emergency management has emergency operations coordination, intelligence and information sharing, risk and disaster planning, resiliency assessment, risk management. All of these are, again, federal mandates, and many of them involve writing detailed plans, creating partnerships, training each one of these plans, and exercising these plans. For public health, some of these a lot of the capabilities we do ourselves. Some we partner with emergency management, and others we just provide an assurance role. And while we're doing all this planning, we're also supposed to be, or required to remain nimble and respond to any kind of emergency situation that arises.
So Lisa ended with a great transition talking about being nimble. Emergency management as an area and a focus area is really preparedness and planning and working with people and to prepare for really anything. At 3 in the morning when a train derails, somebody has to go and know how to handle that situation. When a tanker truck spills and dumps fuel oil into the ground, somebody has to know how to get there right away and stop that spill, and then how to mitigate the risk of that. If we look back at the things we actually do, it is all about being nimble. We've, in the sheriff's office at least, because our previous sheriffs didn't abide or like to do priority-based budgeting. Our new sheriff is on board with it. We kind of looked at our projects and our programs as they were defined, and really those were kind of first round programs. So we've really looked at the national standards, and that's really developed a great discussion in this process, and we're actually somewhat happy to be here this morning to talk about these programs, and because as much fun as it is before being in front of this panel, part of the reality is as we try and get a grip on what it is that we really need to do, what we have to do, what we should do, and what we want to do, it's important to look outside and see what's the real framework that we need to meet, so we're not just driving an internal engine somewhere. As everybody knows, this is a very unique county. This is the entertainment destination for Minnesota and definitely for the Metro. Between Valley Fair, the Renaissance Festival, Mystic Lake Casino and Resort, Canterbury Park, we draw in over 10 million guests per year, a lot of those over the summer. And if we think about the role that we have on this side of the table, we're not just thinking about our 145,000 citizens and how to prepare the county to respond to that. We also have to consider all those extra people. If something really bad happens at any of our entertainment venues, we're there and we're responsible for making sure that we're protecting all those transient citizens that are coming in and visiting us. That's a real responsibility. It's a real challenge for us. And we're going to talk a little bit as time goes on about staffing and numbers, and one of the downsides that we have here as well is that we fall just outside of most of the big funding gap or funding capabilities. We have some grant programs that provide funding based on population, which we use. We have urban area security dollars, which provide a lot of money to the metro area, but of that we only get 1% because we're considered to be outside of the core. So while $5 million may be coming to the metro, Minneapolis, Hennepin County, Ramsey County, and St. Paul are each getting about $1 million a piece of that grant award. So we've got the same obligations that they do, yet we don't get the funding to be able to provide that. So with that, I'm probably exceeding my 5 minutes already, so I'm going to shut up and pass it back.
All right, panel, questions?
So, in reading through your material, and I stayed up fairly late reading through this, it was pretty extensive. One of the things that hit on a little bit, but not as much as I was hoping to hear about, was how we kind of leverage our partners in the community through cities, fire departments, that sort of thing, and working on some of these plans for responses.
So I think I'll start answering that one first. We actually do reach out and work very carefully with our cities and with the different agencies within the cities. Emergency management holds quarterly emergency management director meetings where each city has a designated emergency management director. It may be a fire chief or a police chief or someone else who's designated. We are meeting with them every quarter, and we go through the state of our plans, the state of our requirements, and the state of our exercise requirements, and they are really integral partners with us in developing what our next steps forward are. So for example, we just met with them last week for our quarterly meeting, and part of what we talked about is what each of the communities would like to do for our next exercise. We're on a requirement to do a full-scale exercise where we move a lot of people in a lot of different functional areas to test our emergency plans every 3 years. So we just completed one earlier this year, so now we're reaching out and we're talking with that group about an idea and a concept for what the next exercise is going to be. So that's our first step at really working with that group and reaching out to all those different partner agencies.
Sure. I would say about 60% of the work I do is engagement of partners in some way, shape, or form, and through, whether it just be through emails or conversations. I think a large amount of time is like figuring out who the right person is to engage and then leveraging them. So especially with our medical countermeasures and our medicine distribution, that's a huge partnership where our role is really to plan for it and manage it, but it's the community partners' roles to execute it and carry it out. So there's a lot of private partnerships that are part of that and a lot of city partnerships, police departments, securities, fire.
And just to follow up to that, and I'm not gonna use the right terminology, but it was something about the vaccine distribution. There were several private areas and then public, and it said within 36 hours we can get distribution to everybody within the county.
So the federal government says that we are to give their term medical countermeasures, so medicine distribution, within 48 hours following an anthrax attack. Because we know that the medicine to treat an anthrax attack is ready and available to us, we would receive it within the first 12 hours from the federal government, and then we would have 36 hours to give it to the affected population in Scott County. Now, when I say affected population, that doesn't mean just the residents. It brings all those people that Scott brings into. So everyone who's at Ribfest, at Mystic Lake, it's going to happen on the biggest day during Renaissance Fair and all of that. Vaccine is a little bit different. Just there's not a time frame per se given to us, because as we saw in H1N1, it comes out probably much slower, and we're able to give pills a lot quicker than we're able to give a vaccine. So there's not a given time frame for that.
But our distribution network is able to achieve a pretty robust response, though, is what it looked like.
Mm-hmm.
Well, we have plans for that. We engage partners in helping us distribute. The 36 hours isn't arbitrary. That's the window, 48 hours after exposure, or people start dying. So we actually have to do our best that we can. We have a lot of plans, including head of household dispensing, so one person can come pick up for 10 people. Our plan is the first 10 days, and for anthrax, you have to actually have 60 days, so we would have to do a second distribution. But we try to get pills in people as quickly as possible.
If you go to page 47 in your packet.
Yeah, talk to us about that graph a little bit, Leah. That's a good one.
All right, so these are our Medical Reserve Corps. And these are, Medical Reserve Corps are strictly, it started after 9/11, and it originally started where they were only public health, or excuse me, they were only medical professionals, medical and health professionals, that really came together to respond to an incident. What we found really quickly is that the Medical Reserve Corps needed to be more than medical and health professionals. Unfortunately, our name doesn't make it sound like that. So we've been doing a huge recruitment campaign because you can see in the chart, through modeling, in order to meet that 36 hours, we would need about 348 volunteers to do that work. That means that everyone is going to show up. We figure you got to figure about 70% of your volunteers are actually going to show up because of life. So we have 286 currently. We spend a significant amount of time trying to do recruitment. One of the major partners that we partner with is the Scott County Volunteers, and they can help fill those gaps. But that is a huge thing. That will help us determine whether or not we meet that 36-hour threshold, is if we have the people that can work the 24/7s, the 12-hour shifts, and will they come back?
Does the 348 include the 70%, or we need above 348?
We need above. Yeah. 348 is the number that our modeling tells us to.
So you really need more than that to account for that, for those that
Correct.
won't be showing up.
Yep. This graph does not show pulling any county staff to assist. It only shows our registered volunteers within Scott County.
So it looks so well, which is great, the volunteers are going up. Are you finding barriers to kind of reach that level of where you really need to be if we had an emergency? If so, what are those, and what kind of action are we trying to mitigate those barriers?
So I think we find a huge barrier in that when I started 6.5 years ago, we received funding to continue the Medical Reserve Corps. It was only $10,000, but at this point we get no funding but need to continue our program. So our funding went away about 3 years ago, 4 years ago?
Around there.
Yeah.
What was the source of that?
The source?
NACCHO.
NACCHO. Yep. And so our funding is gone, which means our time for it always continues to shrink. This project, we figure, when I figure my percent, I figure maybe 2 hours a week, and it's always the first thing that's cut. The other thing I think that is a huge barrier is the name Medical Reserve Corps. So it's a lot of education around what we're really looking for. So every nurse that gives a shot in one of those vaccine clinics needs 7 support staff behind them. And so it's really that barrier of teaching people what we're looking for. And then, luckily, knock on wood, someone up there who has wood on there, we haven't had to use them, right? Because there has been no emergency. And when you volunteer, you're like so excited and gung-ho. And I say, that's great, you can come help in our office, or you can assist, at one of our immunization clinics, twice a month. But that doesn't fill the need for the 286 volunteers. And so it's really, really working hard to figure out where we can use them. And these are board-approved volunteers. We could use them everywhere. We can use them in every department. I know that Evan Cole back there has used one. And so it's really getting that word out. Again, that all takes time that, unfortunately, I just don't have. So it's building a partnership and doing that.
And one of the other areas that I want to touch on, and this applies to volunteers everywhere, the people who volunteer to do these types of works, whether it be the Medical Reserve Corps, our Safecom unit, Reserve unit, other units, or work with the registered volunteers, a lot of those people volunteer for a lot of stuff. So while someone may be a volunteer for the Medical Reserve Corps, they may also be one of our Safecom weather spotters. And we all know things happen. I mean, if this scenario happens where we need to get medicine out to a lot of people, all the bad things that happen in life are gonna happen to those volunteers as well. People are gonna be sick, they're gonna have sick families, their cars are gonna break down, they're not gonna be able to provide that support, which is why we need that inflated number. But on top of that, the people who are volunteering oftentimes are volunteering for a number of things. If some of Alexa's volunteers are coming in, but then the Red Cross calls and says, hey, we are setting up a shelter at this location, some of those volunteers are gonna get pulled different directions, and who actually shows up when the time comes is a real tricky guess.
For us, it's that health and medical, right? Because if you're in that state of a health and medical emergency, they're going to be called to fill those needs in the hospitals, and they're gonna get called across their systems really quickly. So, one thing we're doing right now is I have an intern, and then we have an assistant in our office who is really working to get the profiles of each of our volunteers updated, but then trying to figure out where they work. Because if we can identify that 25% of them work in a hospital, we can know that that's one more gap that we have to work through.
So let's go to 48. If I read it right, Lisa or Alexa, we retired the measure, but we still wanted to show it. So what is its significance, or why?
We retired the measure because the LTAR is no longer the system being used. The LTAR was the Local Technical Assistance Review, and it really reviewed the different capabilities that Lisa spoke to earlier that focus around medical countermeasures and medical distribution. So volunteer management, emergency operations center coordination, the medical management, distribution, transportation, those things. It's been retired by the CDC, Center for Disease Control, and switched with the Operational Readiness Review, or the ORR. The way that the ORR is set up, there is no really quantitative way that I can show you the response. It's a online tool that I fill in with several hundred questions that they rate a different scale for every different form I fill out. There's no good quantitative way. Trust me, Lisa asked me about 75 times to put it into quantitative data. I can't even print out of the system, which is a whole issue on its own, but we wanted to keep it in there to show you that they're measuring the same type of things in where we were, but now they've switched. They really have said now you have had FEP dollars for a significant amount of time to plan. It's time to make your plans operational. And so with the Operational Readiness Review, they said by 2020, your plans need to be 100% operational. And so that's what they're asking us to do. Did that make
And it did. And in 2020, we are having a full-scale exercise.
Full-scale exercise means 100% boots on the ground, nothing is simulated. Police department will be there. There will be people walking through, getting pills, probably M&Ms, handing out pills, I should say, and we will have staff handing those out. We will have volunteers. There will be no one that can be simulated during that event.
So that's what, 16 months away?
Yes.
How long does it take to plan an operation like that?
2 years, probably. Planning has already begun.
Can, page number 50, I just kind of want to generally ask, and I might not be reading this right, but it looks like there's a decrease in the MRC, but significantly, but increasing slightly with the safe communications. Can you just talk more about what that really means?
So if one of you want to start about the Medical Reserve Corps, then I'll talk about the Safecom group.
I can. I think it has a lot to do with money and the time we were able to find projects and supervise projects. It also, for me, has a lot to do with who is willing to take on those volunteers in their office and use them. And so we had, back in 2015, we had a couple volunteers that came in on a regular basis and assisted different programs. And we were able to fill those gaps in different ways, or we just had to fill those gaps internally because we don't have the time to supervise the volunteers. So 2015, if I broke it out for you, probably has a couple larger projects that I can think of. We had a gentleman that came in 2 times a week that pulled all the child and teen checkup information for the letters, and they were able to fill that with a paid position.
Okay.
And in the Safecom unit, these are just a translation of actual hours of service we're getting out of that group. So with more storms, more events going on, we're just collectively seeing that that volunteer group is providing more service as time goes on to the county.
And I would speculate, although I have no data on this, I think that as the unemployment rate gets lower, I think more people are returning to the workforce, particularly the senior population, so we have less people available that want to come into the office to do volunteer work. Just a speculation.
With Safecom as well, we've added more responsibilities to them. They're not just weather spotters anymore. They do sandbag training. They do skywarn training to the public and weather spotting training to the public. It's call center and hotline things, and they have more responsibilities than they did, and we actually have more people in that group in the last few years, so that's part of it as well.
That engagement piece.
So Ron, why the more people? Have you been out recruiting more, talking about it? What have you done to?
I think we have been recruiting. We've been posting on Facebook that they exist. I think that's been a big thing. When we do that, we do get a lot of people saying, hey, I'm interested in doing that and learning more about the organization. We typically get 1 person a year, which isn't a lot. But also giving them more responsibilities has led to more investment of their time. They're more integrated into what we do. It's not just weather spotting. We actually have multiple trainings throughout the year that they can be involved with. Exercises, getting them involved with our exercises. So getting them more involved in the processes that we do is, I believe, led to more interest in the group.
And that is a good point. So as we as emergency management division have been really doing a gap analysis for the last year or so, looking at where our weaknesses are, there have been other opportunities to incorporate some of these volunteers to supplement, whether that be helping with our full-scale exercise that occurred this year or to fill other roles. So as we've identified more gaps, we're trying to find ways to use volunteers to fill those gaps as much as possible.
In the last year, during the Super Bowl, the Safecom group helped with a temporary sheltering plan, where they were going to provide temporary shelters in case we had to evacuate any of our things. So they're just doing more than they used to.
One thing you talk about at a couple of different points in your information is Scott County staff's participation in emergency management planning and preparedness, specifically about the lack of NIMS trained employees in different areas and also continuity of operations plans. Do you track on a regular basis how many people we have trained in the different areas that we need to actually staff a incident command response in the EOC during an event?
It's a great question, and I can say we've tried, and I quite frankly think we're failing at it. We have gone through over a number of years prior to my time in emergency management. We've had different training waves. After Hurricane Katrina, the initial mandates came out where everybody that was in a supervisory position was required to have the basic incident command training. So there's a big wave of training and some dollars that follow that to provide that training. And then a little bit later, another event happened and people started paying attention to it. And we're kind of in knock on wood again please, but we're kind of in a quiet period where we haven't had a massive national disaster that's providing the stimulus for that. Now internally, this is one of the areas that we've identified as a weakness. From a cultural standpoint, this county I don't feel is prepared. Part of what we've talked about and we've started to try and devise plans for is as we move forward, how do we build that? You know, I think at the top level, we've done a good amount of training. The problem is, just like everything else we've talked about, if we have the large disaster, we don't need just the division director to understand what to happen. What we need is the next tier and the next tier down. Because one of the big experiences we have here is that people retire, people move on to other jobs, and that's a constantly changing, we have a constantly changing workforce. So understanding who we have with what training and keeping that up. Quite frankly, we need to do something different. One of the ideas we had, which would actually fit really well with what was going on today with the new employee orientation, would be something along the lines of us providing the basic level command training, the required, NIMS required training, as a part of the employee orientation process. So everybody coming in as a part of their onboarding process gets that basic training. One of the challenges we have, once somebody's here, everybody's busy. I don't know too many people who've just got time sitting around where if we send an email saying, hey, did you know you need to also take this very, very riveting FEMA course online? you should do it. We're just not going to get buy-in with that. So culturally, we have to do something different. We have to engage, I believe, at the earliest stages of an employee coming in. That's the time we're going to get them where we can get the commitment during that onboarding process to engage in the basics. I can tell you from experience, we've tried to host some more advanced command level trainings. We spent about $2,800 to provide an ICS 300 course. We did get good attendance to it. That first year, public health sent a lot of people. We got a lot of firefighters, police officers, people from around the county involved. We tried it again the next year. Same cost. We had 4 people sign up for the class. So, you know, unfortunately, we have to pay that kind of cost to get people in. We don't really currently now have a way to say, you really need to come into this training. So that's what we're trying to strategize on. And as we look at our core capabilities, we're looking at what are we gapping on, what are we not doing, and we're trying to find solutions to make some of this part of who we are and what we're going to do moving forward.
And do we work with any of the cities or schools to identify people within their staff that could support the EOC and kind of that incident response? So as you think about the purchasing and the logistics things, you know, those areas have strength, and as if a disaster were to happen, even if we go 3 deep in every area in our organization, if it's a sustained disaster where there's multiple shifts, we're going to have gaps too, and kind of leveraging that so it's a county-wide resource for that EOC and incident response.
It's a great question. So depending on where a disaster happens, will really kind of dictate how things occur. If a disaster is impacting our northern cities, they first have a responsibility in each one of those cities to activate their own emergency operations center and to staff that center. And then the county has the overall reaching responsibility for opening our emergency operations center, and we are the point of contact for the state's Homeland Security Emergency Management Department and for FEMA. So our role is a little bit different. So because of that, if it's a Shakopee, Prior Lake, Savage impacted event, a lot of their staff is going to be tied up at their local level managing their emergency operations center and trying to keep their day-to-day business going and try and get restoration. So our emergency operations center at that point in time really falls more under an area command model where we are providing coordination when Savage needs a backloader, or you know, backhoe and a end loader and a truck to transport that, and a driver and an operator, and then Savage or Shakopee comes with the exact same request. Our role becomes more of that coordination element of, we got 2 independent entities that need the same thing. Let's find a way contractually that we can get that ordered, get it delivered to the first location, get it to the second location, so we're using the resource most efficiently. So our role really changes at that point. Also, a key point I'd like to bring up is that if this event happens in our southern cities, their staffs are immediately overwhelmed. So if it's Elko Newmarket who experiences a large-scale disaster, they're pulling county resources because they're going to immediately exceed the threshold of their local capabilities. And we'll be getting the phone call immediately requesting assistance in staffing, managing a large portion of their emergency operations capabilities. So there's a really big challenge on being able to reach down deep into the cities because of their challenging or their own individual responsibilities and challenges.
Well, and I guess I was thinking more of if it's something in the southern half, pulling from those northern half cities to be able to say, hey, we have additional support here. They're trained in the NIMS. They know how to operate an emergency operations center and come provide assistance.
Yes.
And vice versa, but it's more limited in the southern half to be able to offer that support.
It is. We've actually had conversations over the last year with Carver County to see if it makes sense for us to co-host an all hazards incident management team course, which will be a week-long course where both counties would work together to identify those core capabilities and those core trained responders and get them through a week-long course for incident management at a high level. And in doing so, being able to reach out not just within our borders, but reach out to our partner in Carver. Now, the possibility that they're also impacted by the same event is definitely there. If that capability is exceeded, we can reach out further at the regional and state level and get assistance in through calling an incident management team or through our partnerships that we're making across the region.
And I do know that that works well, because in Waseca, we had a lot of people from other areas coming to
Yep.
help us.
Yep, and you really need that. I mean, Waseca was a great example. I think when I presented at Scale shortly before the Super Bowl about weather impacts and emergency management, I put up a graphic of the precipitation that occurred in that storm, and there was a donut right around Scott County. North Metro, federally declared disaster. South of the Metro, federally declared disaster. For whatever reason, we were really sucking the moisture out of the air right here and pushing it out. I'm not sure what happened, but we got really lucky. You know, Blakely was a 14-inch snow rain event over 2 days. Waseca was 12 to 13 inches over 1 day, and we were really close. We had some really localized flooding in the very southern portion of our county, but it could have been us very, very easily.
Can I just also talk a little bit about, you know, the importance of incident command training, incident management training? It's not just the EOC, it goes far, far beyond, and it's amazing how many people it takes to run some of these incidences. And we have lots of written plans, but for example, if you take a look at the bridge collapse, the mayor turned in the EOC to the public health director and said, take care of the family. Well, we didn't have a take care of the families if the bridge collapses plan, but what we did have in place is all of HHS had incident command training, and it took hundreds of people each day for, I think the assistance center was open for 14 days. Hundreds of people each day, mostly staff, to run that operation, and there was thousands of people there. That was just taking care of the families. If you look at the whole event, it was thousands of people that ran that event, and all of those people, or most of them anyway, it wasn't exactly pretty, but they all had incident command training and were able to understand what their role is, which is really critical in that type of incident.
I think that a really good way to explain it from a public health standpoint, if we have a medical countermeasure distribution need, we have 2 sites we can open. We have a primary in Savage and a backup in Prior Lake. If we were to open our primary in Savage, we would 100% deplete the Savage Police Department, just securing the building. So they now have pulled over Prior Lake to cover theirs, but somebody needs to cover all of the traffic. And the Sheriff's Department will be our transportation security, and so they have been tapped. And so just opening one site, we have completely tapped out our police department and law enforcement resources to help each other. And we know that it's not just gonna be us. And so it's just like one site that quick, we work together, but we don't have the extra deep.
So one of my observations from Blakely, since you brought it up, was we were really good while the incident was happening and for a few days after. But I think one of the things we need to take a look at is the coordination after law enforcement leaves and what environmental health and highway and those places are. It was gone then. There was no more meetings. There was no more discussion. They're not the federal FEMA experts for making sure the funding flows. And somehow the after-event coordination seemed, in my mind, watching from both sides of it and having been involved, it kind of went away. And somehow we need to coordinate that better after the event, and we get people back to their homes, and we're trying to rebuild. It was one of the things in here when I was, you know, kind of looking that whole recovery. Our response was really good, but the recovery process, I don't think went as well.
I can tell you I was the patrol supervisor working the road the morning that the Blakely flooding event happened, and I got a phone call at 4 something in the morning because my overnight staff was gone. I mean, they were exhausted. They were shutting down 169 because 169 was already flooded. South of Belle Plaine, we had a vehicle that went through a flooded water and was completely submerged in the median, and no one knew if someone was inside the vehicle or not. Our 2 people the sheriff's office had working overnight shift, they were completely beyond their capabilities to even manage the first step. So as I came in and tried to get more people and more resources in, we quickly exhausted even the response element. I'm glad you think the response went well. I don't think it went well.
It appeared to. We were evacuating people and, keeping them safe, but that appeared to be going well. In the EOC, we went down to Belle Plaine and we had maintenance and highway, but, responding to those types of needs. But the after just seemed kind of uncoordinated.
And, that's an area that we really talked about, what happened, where the focus was. We've already made some changes. Some of the changes we've made that will help us, I think, pretty tremendously in the future is our enhanced awareness of what the situations are. In that case, I think there was information that this was a limited event going on, and resources went to Belle Plaine to stage, and Belle Plaine had an EOC operational, and that was focused on the Blakely incident. While this was going on, Prior Lake was flooding. And we as a county have an obligation to be aware of that as well, and not dump all of our resources into one thing and then lose sight of what else is going on. And I think that's one of the areas that we are able to learn from that experience. And I think one of the challenges that again, I wasn't in the emergency management role at that time, but as a road supervisor, I called in everyone I could call in. We actually tapped out all the available squad cars we had. And we had more people that could have come in, but we couldn't put them in a squad car. We had volunteers that would come in from reserves. We couldn't put them in squad cars. So we had to shut down 169 south of Belle Plaine, north of Belle Plaine. DOT was out of the area because they were out of resources. State Patrol wasn't in the area. We had all these areas of our really heavily trafficked corridors that we had to block the road so no other vehicles went through the water, and we didn't have any more injuries or fatalities as a result of it. So the resource pull initially was huge. But then the next steps happen, and I think that's where some of the challenge comes with where our capabilities are from a staffing perspective. Again, I wasn't in that role, but as soon as FEMA shows up, FEMA basically requires an FTE to be tied to them for the entire time that they're on the ground. We think about Blakely as a disaster. Really, I don't want to jinx us, but it was really a small event. It impacted a small number of people. If we take the road costs and the hill costs out of it, that wouldn't have even been a federally declared disaster based on the damage. We had a lot of road exposure. We had a lot of hill exposure with the bluffs that caved. But if we think about an event that's like the scale of a large tornado or something worse coming through this county, FEMA's going to be here, and they're going to be here for a really, really long time. If we're going to actually get funding and do this correctly, we have to understand that FEMA may be here for the next 14 years. And that means we have to have at least a dedicated FTE tied to FEMA, because when they say we need to go look at this, when we need to go do this, you can't delay. If you delay them and don't provide them access to sites, we're not getting funded. I think the recovery elements of that incident, from what we've been able to review going back, we had, I think environmental health basically took over mitigation projects from that point in time. They did a great job with it, but was that their primary responsibility? Probably not. But who can do that? We got Paul sitting in the back of the room, or standing up, smiling at me now. He knows his business better than anybody else, and he's got the resources to know what the right way to do things is. No matter what, he's a resource. Should the work get dumped on him, or should it have gotten dumped on his unit? Probably not, but at the same point in time, where's the resource to do it? Lisa's in the back kind of smirking to you now, because I'm going to call her out. Lisa's, up until I think just last year, was still working on some of the contract elements of that and making sure that things got corrected. This year. Even worse. Or it's not, but this is a great example. We have a huge responsibility when it comes to a disaster, and we have to follow correct federal procurement rules. If we don't, FEMA comes back and knocks on our door and says, we're taking your money back. Now, Lisa's done a really good job fixing some things that maybe didn't get done correctly at the first time, and she's still working on that, but the number of hours we're still spending to fix some of those things, it's kind of sad. I mean, we shouldn't have gotten there to begin with, but that's where part of the challenge comes. How do we, and I think you'll see that throughout this whole presentation, how do we have the resources so that when something bad happens, we can actually direct the activity so it happens correctly the first time. The last thing I want to do is go before this board and say, I know we had this disaster, and I know it's 3 or 4 years after this disaster, but FEMA just came back and we didn't follow the correct rules, and we're giving back $4 million. $4,000 we can maybe manage. $4 million, I don't know that the board would keep me employed after that. We don't want to do that. We don't want to put ourselves in that situation. But really, I think we have to look at the resources out here and what we have from a capability standpoint. In emergency management, for example, Ron's our one FTE that's assigned to emergency management. My role is split between communications and emergency management, so I spend about 75% of my time on the 911 center operations, about 25% on emergency management. So we have really 1.25 FTEs working emergency management. So when the next disaster happens, how do we have the resources to keep FEMA happy so we actually get our money? How do we make sure that we're doing mitigation correctly? How do we do these things? And that's part of the challenge that we're here, and that's why I think this is an entertaining opportunity for us to really say this is where we're succeeding, and quite frankly there's some areas where we're not, and we don't currently have the capabilities, at least within our division, to be able to do all these things, not correctly at least.
Scott, can I just, so just to kind of tag on that a little bit, I think that's, those are really great points. Some of this training that you guys probably all are a part of, is that, do we have mandates for other folks, other staff throughout the county that maybe could play roles in this, to have this training, or that it's not required?
So anyone who's in a supervisory or management component, or anyone who would be responsible for operating in an emergency operations center, is required to have the basic and the next, or the intermediate level incident command training. So someone's required, everyone who's in that capacity, who could, quite frankly, if we go 2 to 3 tiers down, that could be a lot of our staff. They're required to have that 300 and 400 level course, which is a 3-day and a 2-day course. That's a lot of training to provide to our staff, and I can tell you we're gapping at that point right now.
It really takes like a buy-in and an understanding of the work from the directors and those above it, and I will say that, I'll look to Pam back here. She got the fun joy of being my supervisor for a while, but I always am thankful for that because she got a really good understanding of what I do. And so in our department, I would say all of our staff take 100, 700 and 800, and that's real baseline. Megan over there took it yesterday, so she can contest to that. But then we have about 75% of our staff that is trained at that 300, 400 level. Now, that's much easier to do when it's 18 people, right? And that will be tapped out in the first shift. So that's great, but now we just have one staff or one shift covered. But it really goes from that buy-in and that understanding. And so when Captain Haas talks about getting other supervisors and directors to know, it's much easier to play the game when you know the plans ahead of you, and it's a lot easier to recover when your response is done well.
Go ahead, Jay. I was just going to comment though on the staff. I think our staff are really committed and want to help. I go back to the flu response.
Yeah.
And I saw every staff person from our division putting in hours when you talked about 1 per 7 back behinds, filling out paperwork, doing things. And so our staff steps up, and they no doubt will do it. I think it is a discussion on getting them engaged and having to do that, because they do want to support, and most of them are here, right, ultimately for safe, healthy, and livable community. And just having watched that flu response made me see right there the engagement of our staff and wanting to support what we need to do.
When I'd just like to highlight on that and say this county works because of that very thing that you're talking about, the engagement we have from different people in every division of this county, the willingness to come in on short sleep, the willingness to work extended hours, the willingness, I mean, the number of people who respond to emails on the weekend, not that I should be sending emails on the weekend, but the number of people who respond to emails on the weekend who are working, it's that dedication that we have in all these different divisions of this county that really builds this county. That's why we're successful as a county, period.
Yeah, the day I saw the snowplow driver helping to give immunization shots because we had to support those kids, you know it's there. It's there.
I would have a separate question, but I would add our residents, we reflect the culture of the county we serve, and our residents step up that same way every year at the volunteer recognition breakfast and the picnic to see the hundreds of people who are in the room, and then there are hundreds more who aren't in the room. So the numbers on the graphs may not reflect it, but as somebody who at least works down here, not currently a resident, I take some comfort knowing, really truly believing that the residents will step up the same way the county staff step up and put in extra time. But that was not my,
Can I just quickly comment
Yep,
on that real
sure.
quick? Not to just like totally deflate, because I believe that, and especially those small county, that's the beauty. I come from a town of 100, that's the beauty of Scott County, right? You get that small county feel with the metro really close. I cannot take a volunteer that is not registered and board approved. And so that's gonna be a sad day when I turn all those people away. And so I need them to register ahead of time, and I need them to take that little bit of time to fill out the paperwork, because I will literally have someone that has to stand there and say, I am sorry, June, you can't help your community because you didn't fill this paperwork out beforehand. So, and that's
That's-
a legal,
And I wanna
and that's a
add to that
legal
also.
thing,
And
not
I'm
a.
gonna add when you're done adding.
Okay. The other-
and then I'm gonna ask my,
You're gonna forget your question, but write it down. One of the things that I think we are lacking, and I would like to focus some energy on this, but staffing is an issue, is community preparedness, and whether they can volunteer for the county, that's one thing, but anybody who's not prepared in the community is gonna become a county problem. So they're gonna the expectation is that the county will be there to help them, and if there's multiple emergencies in multiple locations, we're not gonna be able to make it everywhere. So we need to do a better job of training in the community on what to do in case of a flood. Are you prepared for a flood? Any kind of emergency. Do you even have an emergency backpack at home? Do you know where to go? Do you know where safe places are? All that engagement we're not doing. We could probably do a lot more training in the community on what to do, or getting some citizen teams to be able to help their neighbors. Otherwise, they're gonna be on the phone calling 911. They're gonna be on the phone calling the city, they're calling the county to come and help them. And we need to really focus on increasing that resilience in the community, because the more resilient and more ready they are, the less impact an emergency will have, and the faster they'll be able to recover.
So one thing we want to think about with volunteers is that there's a lot of good people who have good hearts that want to help out after disasters happened. A lot of those people with good hearts don't necessarily have the capabilities to help out after a disaster happens. When St. Peter was hit by a tornado, KDWB filled buses loads of people from the metro, and they all hopped on the buses and they went down to St. Peter, and all these teenagers, some who didn't have parental permission, showed up in their flip-flops. No one had food, no one had water. They didn't have tools, but they were there to help. So now, on top of managing the emergency, someone has to manage all these people who just showed up, who don't have the capability of truly helping because they're not prepared, they're not equipped, they're not registered. And if we allow those people to work and they become injured, now if we've allowed them, we have work comp issues that come up. If we've allowed them to work and become disabled, there's a whole number of things that can occur, all at a time when these people may have great hearts but not really have the capabilities that we need. Same thing happens with donations. The one thing that happens in every national event is everybody wants to feel good, so they send truckloads of stuff. You know, people send perishable goods to disaster zones all the time, and it rots. And now we have to dedicate FTEs towards dumping perishable goods because people feel good about sending bananas down to the hurricane. But when those bananas get there, they've been in the mail in a package, and by the time someone opens them, they've rotted, and now they've attracted bugs, and now we've got a sanitation problem. And this happens every big disaster. As soon as it hits national news, people will start sending stuff. And it's a huge challenge. People feel really good about that. But the help that's being provided is not necessarily the help that's necessary to be provided. So we have to do a better job when something happens at really getting clarity out for what we need, what that resource, and how to tap that volunteer potential without opening a can of worms for ourselves. You know, there's a number of organized volunteer groups, including some locally, like the Heart Group that's here, where people are trained. They have, teams that come out and do muck outs when a basement's flooded. There's people who have the right equipment, the right cleaning gear, the right training. They know how to come in as their organized team and come in and clean a house out and get the muck out, get the mud out. It's not a pretty job, it's not a fun job, but it's something that's really necessary because there's not money that's gonna come down to do that kind of work for individuals.
I will say on volunteers too, Kara Madsen, our volunteer coordinator, she's been one of the most proactive people as far as disaster preparedness that I've met. She's taken the trainings we've asked her to take. She's gone down to St. Peter and taken a volunteer and donations management course. She gets volunteers for every one of our exercises. She's just done a great job supporting us, and I have no doubt that she'd support us. What Scott just described and Lisa described, we call that a disaster within a disaster. When we get donations of teddy bears, if we accept them, we have to store them, inventory them, keep track of them, and it's a lot of time not spent on the disaster itself. And it's the same thing with volunteers. At Blakely, we had MINVOAD organizations come down, Minnesota volunteer organizations active in disasters. That's the Red Cross, Salvation Army, and a lot of the smaller groups that come and rebuild the fences, clean the houses, provide food for people, provide shelters, that sort of thing. So that's usually who we ask for in a disaster, are CARA's volunteers and the MINVOAD organizations. And we try and keep everybody else away, or direct them to CARA to go get the background and all that certification.
Can I also just clarify? I don't want, and then we'll get back to Jake's question. I don't want all of us to think that we're talking about the big one, because a lot of this is kind of a fragile house of cards. H1N1 on the grand scale of things, pretty small. It was a pretty small event. The capability and staffing is one thing, but if you look at just one recent example in Minnesota, they had one healthcare worker return to a county, not ours, and apparently had active TB for about 4 years. The number of case contacts that need to be done that they know of right now is over 2,000. And as those case contacts need to be done, it's probably going to exceed 6,000. These are people that they have to find, to call, to get tested. That alone would overwhelm us, and we would have to be using our volunteers, and it would go on for a very long time, but we still have to do this case contact investigation within a certain time frame, or people get sick and expose more people. So it could just be a simple thing like that leads to such a snowball effect that it will overwhelm us.
Okay, Jake.
Yeah.
Question away.
Quite a build-up. Deb, could you go to page 42, please? I think that's the closest one. So we talked a little bit about capacity, and this is an example of one of your 32 core capabilities that really make up the meat of this comprehensive packet. And of those 32, by my count, there are 20 that we're not meeting the core capability, 6 where we are meeting, and 6 where we're exceeding. And I'm wondering if you could talk a little bit about, is it necessary for us to be meeting at all 32 of those, exceeding all 32 of those? Are there some where it doesn't make sense for us to aspire to exceed? Are we exceeding in the right places? Do we have it backwards? Could you just try to concisely provide some context for that?
Concisely being the operative word. That's a great question. These are the federally expected responsibilities of emergency management divisions. Do we need to do all of them? I think it's a reasonable question, and quite frankly, this is a question for the strategy group on the board. Do we need to provide these? Because at the end of the day, when something isn't done, the question we've brought for why didn't you do that? And if we can support that we didn't do this because we chose not to do it, it's kind of like a federal mandate of any other federal mandate. What is the consequence of us not doing that? If the consequence is absorbable and acceptable to us to not do it, then maybe it's okay that we don't do that. But really, this is a policy decision on what ultimately the board and the county administration decides we should and need to be doing. I can tell you that if we don't do something in this packet and something bad happens and that area is not fulfilled, someone's going to have to answer the TV and the news, and someone's going to be investigating. And some of these, there's potential for criminal investigations that can occur into our conduct if we fail to provide basic capabilities. So some of these we have to provide, 'cause I don't want to go to jail, just like I don't want to get fired by the board. But ultimately, a lot of these are policy decisions. You know, this one, we're looking at natural and cultural preservation. After a disaster, we have to look at how we're rebuilding. And this is no different than when we're building a highway. You know, when we're building a road project, we have to look at, are we endangering, you know, the frog that's never been seen before, or a butterfly? Are we, especially in this area, are we putting new construction, or are we storing debris in an area that could have been a culturally significant location for the Shakopee, Mdewakanton, and Sioux community's history? And we can't take our debris management site and just say, we're going to put it out by 83 and 16 and start dumping debris, because that may be a burial ground. It may be, there may be something significant to the culture of our residents, or the community with the SMSC. And there may be some environmental reasons why we do that. So can we decide to not do this one? I think it's a good example. It ultimately comes down to a policy decision, because everything we choose not to do has a consequence. And if we can own that consequence and be okay with that, then yes, we can not do it.
Following up on that, and this one actually is a really good specific example. Is this one where we can tap other partners in the county and in the community to say, you are identified and being responsible for this, instead of your division having to individually manage this particular component?
Yes, in the scope of a disaster, or even our normal business, you know, if something bad has happened, I can tell you, between Ron and I, we don't have the staff hours to even worry about this. We just don't. But that's where you saw, I think, in the Blakely event, where things were reached out, and you saw the soil and water conservation and natural resources people doing, in that case, mitigation projects. Now, should there have been better coordination? And to Leslie's point earlier, I think so. At the end of the day, we should still have a really good idea of what's going on. I shouldn't have to ask Lisa if she's still working on something, because, quite frankly, we should know. We should know. We should have that knowledge. Now, we're not capable, and we should never be capable of doing all these functions ourselves. We'd have to have a huge staff, and I don't think that's in the county spirit. But it is. It's all about partnerships. You know, we already have been working with Shakopee, Mdewakanton, and Sioux's public safety very much in depth over the last year to develop partnerships with them. And we know if this kind of a situation happens, I may not even know the correct person to call out there, but I know the person who knows the person. And that's what's going to happen. We're going to get the right person in our team.
And part of this is planning and knowing where they are. The SMSC has been very proactive along the river in identifying and knowing where some of those cultural resources are. I would guess they're even mapped, maybe Matt, in some cases. But the other thing the county did really well that helped at Blakely was we had bought out 5 homes down there as part of the bridge project on the timeline of the homeowners. So we got FEMA to go along with when they were ready to move. We knew they were at risk because of where the floodplain was and what the bridge was doing. But there were 5 homes gone at that time that would have been severely flooded if that hadn't been proactive. So we've done some of these proactive planning things,
Right.
I think, very well.
And the hazard mitigation project, like we did in Blakely, I mean, this summer alone, with the river as high as it got, we would have had flooding at those homes again.
Yep.
So it shows the value of one of these core capabilities of that hazard mitigation project. It saved us a lot of money. And I think FEMA has a stat of, for every $1 they spend on flood-related hazard mitigation, it saves $5 to the taxpayer. And they evaluate projects when we submit them based on what the return is going to be, because they know historically if we buy out that house, we don't have to keep paying on it and paying on it and paying on it. Ultimately, the taxpayers save money, and now we're not investing resources in trying to rescue somebody or somebody's pet out of their house.
Have you gone through and looked at all 32 of these and done a prioritization exercise to say this is the area that we really need to focus on and get these plans in place, and then kind of, you know, cascade it down to, not that it's not important, but less critical?
No. Have I looked through all 32? Yes. I actually spent a great day of PTO looking through these and refining these for this presentation. As I talked about earlier, within the sheriff's office, because we didn't engage PBB with the previous sheriff, and we have an opportunity coming up, I'm told, that we'll be able to redesign our programs soon. That's what started us in engaging these capabilities, because we didn't want to just come up with, well, this is what we do. We wanted to have that outside influence, that outside basis to say, what programs are we required to do? What's the outside standard? What's the outside measure? I'm actually attending a class in September specifically on a evaluation technique similar to this, and I may throw a few more programs in after that. We'll see how that class goes. But as far as prioritization, no, we haven't gone through and determined what the true priorities are, and I think part of it comes down to the fact that these core capabilities are spread across many different phases of an event. So some of the planning, I mean, we know we have to do plans. Part of that is if we don't do our plans, we're not going to get federal funding. If we don't have our plans and at least be able to check that
It's a
box.
high priority, that funding.
So somebody in the panel may find that to be important. So we, you know, those are things we consider. You know, what do we have to do? We know that if we don't have our plans, not only do we lose our grant funding, which is a significant portion of our overall budget, but on top of that, we become ineligible for federal relief. So if we do then have the disaster, we're not going to get funding, and that could be a multiple $1-million consequence to not doing that. So we're pretty new. I'm still relatively new in my position, and this is part of the path that I've been taking to evaluate what we're doing, why we're doing it, what we want to do versus what we need to do, and give us a basis. But it's going to take some work for us to really refine these and determine what's a capability that we need to be doing internally and what's a capability that we need to really be establishing the partnership to do through an external means, either external within the county or external outside of the county.
You guys good? All right, I'll open it up to the audience.
I'll summarize with that.
Hi, can I just ask the 2020 operational review?
Full-scale exercise? Oh,
Yeah, the
yes.
full-scale exercise. It just seems like such a great opportunity for all of your programs to learn some things. And I'm wondering if there are data measures or markers that will tell you after that how well that went.
So the Center for Disease Control, which is where our emergency preparedness funding comes from, will guide those certain things that we will have to measure, along with MDH will give us. So to Danny's point when he talks about have you prioritized, my priorities are always determined by MDH because of grant guidance. And so they will tell us our objectives and give us our data that we need to collect. And then we will definitely take a look and use our data analyzer to see what else we can collect without further burdening us. So there'll be lots of measures. Throughput, staffing, there'll be quite a few. But they usually will be dictated by CDC and MDH. Okay, thank you.
Building on Chris's question though, like your, the one you just did this spring, I couldn't read in here how successful you thought you were, or any measures following that. It was like we did it.
So again, this comes down to the point that we haven't, as a division, created KPIs for our different programs, and quite frankly, that's something we're trying to establish the framework for programs before we get too in the woods on that. However, the point of doing a full-scale exercise is to test your plans. At the end of the day, that is there. So if, for example, we had a pet sheltering plan, and we'd adopted it, that was our plan that in the event, so we're, some backstory here, if we open a human shelter, we're federally required to open a pet shelter. So if we're sheltering humans, we have to be able to shelter their pets as well, or have to have an environment where they can bring their pets within the shelter. After Katrina, when people wouldn't leave their homes because they didn't want to lose their animals, now that's one of the mandates we have to have. So one of the elements we tested was, does our plan work? So we used the group that we'd worked with, our community partnership, that said, yep, we can completely do this plan. They were partner with building that plan. They said they could perform the plan, and then we implemented the plan as a part of this exercise. So with the exercise, part of what we did is we said all these different things are going to happen, and we're going to test the ability of that center to process these animals coming in and going out, and are they doing things. And we learned a lot. We learned from an organizational standpoint we need to do some things differently. Some of the key criteria that we had established in that exercise was some things that we think are pretty basic now. Are the volunteers who are working at that pet shelter going to check to make sure that you're actually the pet owner before you are allowed to go back and take your pet for a walk? And there's some gaps that we definitely found there. So while it's not as clean as, and definitely not as quantitative as, a number, what we did is found that our plan said this is what's going to happen, and then we deployed the plan and found out that this really happened instead. And now we're revising the plan as a result of it. So that's really the concept of exercising, and Alexa's about to jump out of her seat, so I'm going to stop.
Yeah, sorry. I think that we're missing a really important part, which is all of us up here are what's called HSEEP trained, which is Homeland Security Exercise Evaluation Program. And so, right, yeah, it was fun, whole week, you should do it sometime. But with, with that comes a standard way that we evaluate all of our trainings. Everything from a tabletop discussion to a full-scale exercise. So that pet shelter that he was talking about, Ron wrote what he wanted evaluated. He gave that to me as an unbiased evaluator to come out there and watch it take place. I evaluated it. We went through a hot wash where we talked about it and went through the points. He then wrote up an after-action review, and within that after-action review, there is an improvement plan and and corrective actions. And
Strengths and weaknesses.
Strengths and weaknesses of every one of those components. And so if you, in public health, if you go out to Scoop, you'll see our emergency preparedness corrective actives that we throw up there. And we have a list on Scoop that we assign those different to, and you give each of those a timeline, someone who is responsible. So that's already built into our system of everything we're doing. So.
In our improvement plan, our after-action report, that was 74 pages of things that went right about the exercise itself, but we've already incorporated a lot of the changes and improvements that we identified in the exercise. We've changed where we get our pet sheltering equipment, for one thing. Talked to GIS about the damage assessment app that they created and some of the improvements they could make to that. I mean, we've already started the ball rolling on improving that, and that was less than 2 months ago.
You have to write the after-action report within 60 days, and then you usually assign yourself. You try to do it within the year, but it depends on what the corrective action is.
Other questions? Quiet, Paul, nothing?
I don't know if it's a question, but I do agree on the coordination thing. I think with Blakely, we have the preparedness side, and then the mitigation side is sort of handed off to us to do the long-term planning, and to some extent, staff just stepped up in roles, and it's unfair to expect these guys with the person and a half to do the mitigation side of it as well. So I just want to say staff expects that we're going to step in, but we could coordinate more on that.
I would say that we do the mitigation side after a disaster. FEMA was here for 6 months after June 19th when that happened. They left, I think, January 19th, and that was what Chris Weldon did for 6 months, was basically the FEMA stuff. I did for 2 weeks the response portion of, I was managing the EOC and dealing with the citizens they got a code red message every day with updates on what the status of their situation was, sent situation reports to everybody, sat in on state conference calls. I mean, we were only 2 people. And at the same time, we had a mitigation project going on, and we had to meet our federal requirements that we have to do whether there's a disaster or not. So it's an example of getting overwhelmed in the situation. And we talked earlier, Scott mentioned that in the grand scheme of things, for Scott County, Blakely was a huge disaster, but in the grand scheme of things, when we compare it to Joplin or Katrina, or a lot of the bigger events on a national scale, it's a small potato thing. It's a real small thing. In February, I was at a training at a conference, and we met with somebody who was on the recovery team for Joplin. She said FEMA is leaving in 2021 from Joplin. That event happened in 2011. They have to have a full-time person with them, and they had to create an entire disaster recovery team just to deal with the recovery of that one event. And if that happens here, I don't think that's an example where we're not prepared for the long game, I don't think.
Could add just one more thing. The other side we hadn't talked about is the state. We didn't know from the state for 6 months whether they would provide any financial assistance for the public works stuff, and we didn't know for a year whether they did provide any assistance for the private people. And that was tough to take all those phone calls and not be able to give people answers.
Yeah.
All right, so Alexa, if we were sitting here a year from now, or maybe 2, what do you hope we will have done by then, gotten accomplished?
Well, I hope that we've accomplished our 2020 exercise. That's the forefront of my mind. But really when I think about it, we can play basketball with 3 people. That we can do it. We can be competitive. We can win games. But we all know we should really play it with 5 people. And we should have the time to practice beforehand with those 5 people. And that's what I hope that we've accomplished, that we have taken the opportunity to engage the supervisors and the directors to know those plans, where they fit in, to identify staff that could be pulled and assist, and to train them, to really, to concise it is to make my plan known to more than just myself.
Ron?
I think getting everybody in the community on board to say that it's not a 2-person job, it's really the entire community's job to be in emergency preparedness. Scott and I both had the opportunity to go with the Integrated Emergency Management Compact. I went with Dakota County, I went with Washington County. They took their entire county, their board of commissioners, their county administrator, their department heads, and took them all up to Camp Ripley for an entire week, and spent an entire week doing an exercise up there where they didn't go home at night. They all stayed up there and did the whole thing. They had FEMA come and provide the exercise, and it was so different than anything that we had ever seen here. I think my long-term goal here would be to have this county do the exact same thing on that level. Get everybody out of your regular jobs. You're not answering phone calls and dealing with your day-to-day job, but actually focusing on what you need to prepare for that event, and then dealing with that event as it happens.
I probably would just echo some of the things that were just said. I would like to see 5 years from now, 3 years next year, that we're a little bit more proactive than we currently are, and more of a cultural preparedness kind of embraced within the county. Get more people trained, get more people aware, and just for us to be able to move from operational readiness to an actual response. I think that.
So you hit on a big one, I thought, when you talked about the resiliency of our residents themselves. Do you have a plan for that?
I know in a previous position when I held in Bloomington, I ran a community emergency response team program, CERT program. There was funding available, and it was a citizen response team. There was a lot of training that was being done, quarterly training, and we had probably about 250 people trained in the community that would be responding. I think we need to look at our own house first too, like do some kind of training among staff to respond, like a disaster or emergency response team in each of the divisions, and kind of set that stage and, walk the walk.
I think our biggest challenge for me moving forward is that we need to really operationalize our plans. What's driven a lot of our emergency response plans is FEMA or CDC and the public health side of it, directives. You have to have a plan for this, you have to have a plan for this. And that's great. Ron can write some really nice plans, but if the plan sits on a shelf, it's really not a functional plan. So what we need to do is continue with our steps of engagement. When we did our exercise, we focused specifically public works heavy because we had a debris management plan, but it had been sitting on a shelf. So if the public works people have no idea that there's even a plan, because we've had changeover since it was written, how is that ever going to work in a disaster? So we really need to focus on incorporating more and integrating more smartly with the actual subject matter experts when our plans are being revised, and they have to be actionable. At the end of the day, we can write a book, but if no one's gonna read it, it really didn't serve a purpose.
So with that, I want to thank you guys. I'm going to turn it over to the board here, but I think we talked about a lot of things and learning and moving forward and things we need to fix. You know, I heard you talk about it made you think through and work together. And I think if I've heard one thing from Scott Delivers, that's been part of it, is those discussions and having to think through. The other thing is, it seems to me that maybe even in the future, there seems another couple natural relationships, like zoning could maybe be here for a discussion, and I think Paul's group with environmental. And so to think about that too as we're moving forward and we get together again to talk about your progress by 2020 and how your event went. So anyway, I'll turn it back to the chairman.
Okay, thank you. Very good presentation here. Commissioner Brecky has it.
I have a list of things, but the commissioners to either side of me asked me not to go over all of them. First of all, just thank you. This was really refreshing. I think it's the first Scott County Delivers where somebody has repeatedly talked about being fired or jailed. So, and I love the quote, entertaining opportunity. So I really thank you guys for the realistic presentation here. It was realistic, eye-opening. I think you're challenging us, because now that you've made these concerns public to us, we do need to react. I guess I'm going to echo what Danny asked you to do, what Scott talked about a little bit. We really need your team and those of you and others who are involved to prioritize the missing links, or the parts that are missing, because we all know that resources is the issue here, and especially resources on something that we hope we will never, ever, ever use. We got to be ready. Every time there's a disaster, the jurisdictions involved are criticized up and down by their own people, by the whole nation, by the whole world, because they didn't respond as well as they should have. That's going to be a given, but we need to do the best we can. So we need to look at those 32 areas and really prioritize that where more support is needed. Because if we have any more support, it shouldn't be up to us. What do we know? What do we know? We really need to see that. Well, I guess he knows a lot. We need your opinion on those priorities, because you're bringing those to us. We need to know that. Another thing that I'm just going to talk about things that I think as a board we can help with, or that we need, is so much of what you do is mandated, has lots of rules. Where are there things that we can go to bat to the state or the feds that isn't serving you well? What types of mandates, what types of requirements aren't producing a better product or more protection for our citizens, but are taking your resources? I mean, maybe Paul knows that we can change little things here and there, and we did that last year, a little thing that may help a little bit. But if we can go to bat and change something that is using resources unwisely, or maybe in a way that was appropriate 10 or 20 or 50 years ago, that's something that I think as a board we'd really like to know and that we could make a difference on. But thank you for bringing this up. I think that I'll challenge myself and my colleagues up here. We should all get signed up to be emergency management volunteers. We should get trained. That should probably be a requirement of commissioners. So hold us to that. I think Commissioner Beard has already identified another volunteer or two for you, and that's all I'll do for now.
Okay, thank you. Commissioner Beer.
Thank you. I'm going to dovetail on that. There's no shortage of need. With whoever's sitting on that side of the table on the month, there's never a shortage of need. We should try to really work ourselves out of a job, because we never will, right? There's no shortage of need. But there is a shortage of resources. So as Barb mentioned, you're the subject matter experts. You mentioned priority-based budgeting. I always hear we're a data-driven organization, so I'm simple. There's a lot of things going on. I always look, what's the triple D? what's the data-driven decision that we can make as a board that can fill the gaps as best we can? Because, you know, we've got 32 agenda items or FEMA report cards, if you will. Sort of on Jake's questioning, if we were able to do 10 of those simultaneously, because hopefully not 10 of those things are going to happen at one time, will we be exceeding in all of the other ones, is one question. And then I think Danny kind of alluded to, and what Barb jumped on, is the priority part of this. We have to make decisions that move the needle. And what I look at is what's the data-driven decision we can make that not a bunch of shotgun shells, but one rifle shot, one arrow, that if we were to send it to the target, man, we would move the needle and cover a big gap. Maybe not all of it, but a large piece of it. Because using the example of the rotten bananas, whoever mentioned it, boy, it felt good. I did something. I'm acting out of a good heart. Oh, this is awesome. We got to dump it. We got to store it. We got to inventory. I don't want to make a decision that is warm and fuzzy and it feels good and I'm cutting a ribbon or I've got a golden shovel and look at me. What did we do that moved the needle? Something happens, and we know in this county it will. We live in a lot of water, so history tells us water things happen. Hopefully some of these other things don't, but likely, hopefully we don't ever have to use them, but in this crazy world we likely will. When we need that switch turned on, I want the lights to know that they're going to go on. What can we do? What can I do as a board member to move the needle and make a difference? I'm less worried about the warm fuzzy stuff. So those are kind of how I look at whoever's sitting at the table, and this is a big one. Next month it'll be a different topic, but the same sort of issues. Limited dollars. What's the data-driven decision we can make to help you as the subject matter experts do that job and do it well? Because I'm not the expert.
Good question.
I got it.
Oh, Commissioner Hall.
I'm wondering about our regional training center. When we started that, we had a very comprehensive concept in mind. It wasn't just a burn tower, it wasn't just a shooting range. It was for all kinds of emergency training, you know, whether it was a hazardous spill or whatever. So I'm wondering how integrated we are with emergency management and the training center. I noticed Mike Breeze isn't sitting at the table. And for example, I want to just pick one. It says here we're not really meeting, or we're on the not meeting scale to on search and rescue. Well, I would wonder why, or could we have a search and rescue training component at the regional training center? I mean, if we're having a problem with this category, perhaps others in the region are too, and they could come and pay for training of a search and rescue that is offered through the regional training center facility. So I would like to encourage you to explore a stronger link to with the training center with all things related to emergency management. Part of me wonders if you should even be located out there. But, you know, that's just my wonder. I'm not suggesting that as a recommendation, but I do wonder. But I think we need to have our training center be more comprehensive, offering more things than we are doing now. And some of it we did, I think when we started it, we did contemplate that. And maybe I'm wrong in my suggestion here. Maybe you're already doing that, but that's some of the thought I have. Do you have any response to that?
So we actually have been using the RTF. For example, the ICS 300 course we used was hosted out at the RTF.
I know I took NIMS training out there.
Yes, so we actually got you know, a good group out there. It's a good facility. The sheriff's office uses that building all the time for trainings. One of the challenges we have is we've actually tried to host regional emergency management trainings, and the attendance is so low that the trainers pull out. So we've offered to the state that the state offers free training. So we've offered the location to them, and what they found is that they get such a better turnout if they offer that in Minneapolis than Jordan, that they're going to offer it in Minneapolis. So if we're paying for it, we can host it there. But some of the best training that's out there is stuff that we can bring in, and the state's just found that we don't, for whatever reason, draw enough people when we have a class out there to to get people from all around the state to come. So we're not selling the facility somehow correctly, and I'm not sure what the answer is on that.
Okay.
Getting it to the next 2 weeks.
Okay. Commissioner Beard, you had a question or comment?
I was thinking about our little visit out there to the regional training facility a few months ago, and the magnificent blossoming of the mosquitoes was just sensational. You may want to leave that off your sales brochure when you're selling. Just a couple of quick comments, and I'm going to ask for one response. The state, somebody talked about the state, I think Paul mentioned, you know, when you're dealing with FEMA, I've heard the horror stories of you've got to keep your invoices in consecutive order, and the dates have to be right, and I's dotted, T's crossed, or FEMA will kick you out, kick out the reimbursement. It's the state that tries not to be quite that persnickety. However, they don't have a pool of money sitting around waiting. And I know the legislature tried after several events. I think the year I was transportation chair, we had the 19 inches of rain in Duluth that one weekend in June. It blew out city streets and everything. And MnDOT and PCA and everything, we were on the scene Monday. I think it happened Friday, Saturday. We were there Monday assessing the damage, and I think the special session was called at the end of that week to give the authority to the agencies that needed to step up for state infrastructure on that. But there was a fellow by the name of Gene Pulowski, Representative Gene Pulowski from Winona, has done yeoman's work on trying to set up some sort of an emergency management board on the state level. Funding it has been a trick. We could always find $4 or $5 million to put in that account, and then the authority to spend that, who gets to spend it, and who gets to say that Blakely gets some, but maybe Maple Grove doesn't. You know, that's a lot of give and take going on there, and I don't think they've refined that process yet.
So I can actually answer that question. The state actually did succeed at creating a state disaster fund account. Our thresholds to meet that account are actually set for 1/2 of the FEMA standard.
Okay.
So if we meet that threshold, it lowers at a lower level disaster can receive some state funding. So it's not 100%. The funding mechanism, I don't recall the exact formula right now, but it's a lower level funding until you hit the federal threshold. If we do hit the federal threshold, then we can also use the state disaster fund to supplement what the FEMA funding does not provide. So that fund is in place. We're actually one of the few counties in the state that hasn't tapped into it yet. Again, thankfully, over the last 2 years, since that fund's been designed, a lot of stuff's happened in the state. It hasn't happened here yet. But if nothing else, it created a bullseye for our county for whatever's coming next.
Well, part of the motive, I think, for doing it was to try to depoliticize that process, because I'm thinking about the Delia fire that burned the downtown down, might not have complied or met certain thresholds, but nonetheless, a legislator that was favored by a lot of people could tell a great story and find a couple $2 million. You didn't want to have to go there if you didn't want to. It was great if there was a process that had been agreed upon by rational minds without the pressure of being in the moment. It's a good week. We know about that. Yeah, Commissioner Brecky talked about the Medical Reserve Corps. I got to tell you, my wife is a medical professional who's retired and would say kill to get into this, but there's police in the rooms. I won't use that word. I mean, she would love to be in this program, and I'm thinking there's got to be a way you can tap people like her, because I know there's hundreds of them out there that are retired and probably have never heard of this. At least I haven't, but don't let that be your standard. I don't hear about a lot of things. So, the last one regards your comments about the Blakely issue, and I heard some anecdotal stories about us standing around, us government types, thinking, oh my, the Blakely's cut off from the world. What do we do now when Union Pacific Railroad came down the road and said, hey, out of our way, boys, we got a railroad to open. Which brings me to this point. The utilities, the power line folks, the pipeline folks, and the railroad utilities in particular have on standby private organizations who are expert in arriving on the scene while the stuff is still happening and figuring out what we have to do next and where it goes. Just you can nod your head and say, yes, we talk to those people, and yes, we are on each other's Christmas card list, and we coordinate with things like that when they happen.
So I can tell you, we can't afford those people.
No.
That the railroad uses.
Yeah.
They will literally fly by helicopter equipment in to clean roads, and we can't do that. What I can tell you is that Jennifer Schultz and us and our accountant have met this past year and talked about actually getting ahead of the game. Instead of, in the past it was, disaster happens, we scramble, we start a procurement process. The smarter way to do this and what we're trying to start building up is, we know something's gonna happen at somewhere at some time. We can pre-contract a lot of work and go through the appropriate steps for making sure that it meets the local and federal requirements, and we can have a standby contract in place. So that is part of the path that we've started the process of, is we don't wanna wait and then have to go through a bid letting, and go through the required times, and we can do some of this stuff ahead of time. So we've already begun that process, because quite frankly, we know it's gonna happen at some point. So we should, as well as we can, capture some of these resources in a contractual standpoint before the disaster happens. And then it's just a matter of activating the contract.
Outstanding, because I'm sure they'd love to hear, not that you have to pay them a retainer, but hey, as long as you're here, would you push that tree onto that ditch or something like that?
Right.
I'm sure there'll be a bill attached to it.
Oh, yeah.
This is the last comment. My little sister runs a Walmart store down in Missouri, and we were talking about the Katrina response and how they already had a fleet of 400 trucks days before they'd already had their logistic recovery plan in place before the hurricane hit. And because we were talking about the looting that went on, she said, well, what's really unfortunate is every one of those stores was unlocked and the lights were left on. They moved all the food and water to the front, figuring that people would be coming. They didn't count on the TVs being carried off, but the food and water they set right up front already anyhow. And so you know about these things, just so if anything, just so they're part of the discussion, that there are some private industries out there that already do take some steps to be part of the solution or whatever has to happen. So thank you for considering those things and for knowing about what else is happening. Mr. Chairman, that's all I've got.
Okay, thank you. Any other questions or comments? Mr. Shelton.
Just a couple of observations, and I would also encourage your staff to look at the 32. When I read through them, some of them are fairly targeted to specific types of incidents, which I think probably gets back to whether it's important or not is where it might fit in a threat assessment as it relates to this county. Do we want to put the resources here? Do we put them someplace else? I was a little bit surprised on your first page. You list the Scott County's top 10 risks being, and so I was sort of surprised to see civil unrest on there at all as one of the top 10, and really wanted to know why disease outbreak wasn't even considered one of the top 10, because that's not listed. And it would seem to me that disease outbreak is probably more likely than civil unrest, but perhaps not. Or to see active shooter ahead of transporting hazardous material, because there are a lot of, with the ports and the railroads and 169, there's a lot of hazardous material. So at some point, we don't need to do it now. I'd like to understand how did you arrive at here are the top 10? Because I would assume that that's probably the first part of then getting to, and of these 32, which would take priority, because I'm assuming they will be based upon what do we consider the most likely threats if we can't be prepared for everything. I noted that a number of them do deal with terrorism, and that that often you noted we do not engage in anti-terrorism programs. And so to that one, I really have a question for now. Should we be concerned about the fact that we're not engaging in anti-terrorism programs? And then lastly, I did hear a lot of discussion about infrastructure. And infrastructure is something that's much more difficult to put into place sometimes quickly when there's an emergency. And so I'm assuming the 800 megahertz system plays an important role, but have we looked at, because my understanding is even that had trouble during the 35W bridge collapse, that the 800 megahertz system itself got bogged down. So have we looked at that? Does our LEIS system, our law enforcement information system that we share with others, does that provide us with any additional emergency management capabilities? have you done kind of that infrastructure analysis to say those hard assets that are really hard to come by quickly, are they really ready if there's, so in a future presentation, I'd really be interested in that question as well. Where do we stand in terms of those hard infrastructure assets?
I can try and take a quick shot at some of those.
Sure.
You talked about the communication system, the bridge collapse. Depending on who you talk to, the system worked perfectly or it failed. There's a lot of lessons learned. The technology worked correctly. What was broken was a lot of users. We had some situations where in this area, the bridge collapsed before we'd migrated onto the 800 system in Scott County. But there was people in Carver County who were listening to the event that was occurring in Minneapolis and not realizing that because there's so many people selecting different talk groups that were busy in Minneapolis in this area, that Carver County wasn't getting some of their police calls out because they busied up their system. And the users didn't know that, well, I'm just listening to what's going on in Minneapolis. They didn't realize that they're tying up a channel of capacity. So since we've added our infrastructure, we've increased the capacity quite significantly and increased the coverage quite significantly. And we've actually tested through a number of big events, a lot of pushing that. I can tell you from looking at the system itself, when we have a really heavy snowfall and the plows are out and they're communicating and 8,000 people are in the ditch and 995 911 calls come in every second because everybody's slipping and sliding all over the place and people are calling because their family members haven't gotten them. That radio system gets tested very extensively, and I'm pretty comfortable that we have the technology in place with that system to maintain us through. Now, again, I referred to discipline as the problem, and we're just as subject to having that come into play. With other systems, I think we've been looking at, how do we harden some of our other systems, and these are all dollar decisions ultimately, and that's why I think it ultimately comes back to the policy group of how do we define how strengthened we do build our facilities, build our infrastructure. It'd be great to have the budget of the railroad where we can just fly stuff in when something goes wrong, but that's probably never going to happen here. So we have to make a decision as far as what is and what isn't, what's realistic. And I can tell you, going back to the beginning of your question, you talked about, the rating. So we're a part of a regional threats hazards identification process. We do a risk analysis, and really that was the foundation for where this group came from. So as a region, we go through every year, and Ron actually sits on the work group that's going through this for this year, and they go through and look at what are the realistic threats for the region as a whole. Because if it's a regional threat for Anoka County, it's probably a regional threat for here. Well, we've got some unique areas. In general, at least the natural hazards are consistent across the area. And also to point on civil unrest, we're very fortunate that we haven't had it. Now, civil unrest is not describing a widespread rioting, but it's talking about areas where, it didn't take much after Katrina before people started completely ignoring rules. And in a civil society, we have these frameworks that keep us civil, and most of the population follows those frameworks. But as those frameworks start to degrade, when basic core services aren't there, if people don't have access to food and water, they really don't care about the rules. If they don't have a safe shelter to be in, they really don't care about the rules. And we can very quickly devolve into civil unrest that way. With the nature of police shootings that have been occurring in the country and the debate around that, the potential for civil unrest is actually quite high right now. And the way that things are organized across the country through social media, if something bad happens, if we have what looks like a bad shooting here, we're going to have protesters and we're going to have rioters and we're going to have stuff on our doorstep before we know what happens to us. Within the state, we've got a pipeline expansion that's going on, and a rusty old pipeline up north is being proposed to be replaced. We could very easily be the next Standing Rock in our area up north. That's the controversial pipeline. I will tell you, we've got just as strong of a pipeline, just as large of a pipeline coming through our county right now. And hopefully no one's going to see that and decide to protest here. If you look at what happened in Standing Rock, something like 90 to 95% of the people who were arrested in Standing Rock were from California, not from North Dakota, not from South Dakota, not from Minnesota. These are paid people being brought in to cause turmoil, to wreak havoc. This is very real, and if we have to staff a situation where we have to deploy a mobile field force for multiple operational periods at a time, we're going to be completely tapped out of resources. So I think that is actually a very real threat that we're facing due to today's culture.
I also wanted to add the threat and hazard identification, the THIRA. The assessment is based on likelihood of happening, so probability. So we're actually a lot more likely to have a tornado in Scott County than we are to have Ebola. But you also have to weigh in the death and injury. So that's why the disease prevention, the disease outbreaks are probably lower on the list because we're a lot more likely to have tornadoes. The other piece too is the disease investigation. We do this every day. We have TB constantly. I think right now we have 4 active cases. So we do have the infrastructure to respond to these things on a small level. We also do a lot of prevention every day. And so if those pieces weren't in place, we probably would have more TB than we actually have now. So some of these things on a micro level, we're dealing with every day. Where we have some gaps is ramping up to a large scale. If we had to do a 2,000 person investigation, or if we had 20 cases of TB, that would probably overwhelm us.
The THIRA actually doesn't take pandemic per se or a large outbreak into consideration. They take health as one of the threats. They take health and medical components to each of those threats. So that would not have been a threat that could have been brought to the top.
Okay. Any other questions or comments up here? Okay. Seeing none. Thank you very much.